Go.
Hi guys, it's Dr. Denny over at Four Paws at Fulshire Veterinary Clinic, and Maddie and I are going to be talking about some more frequently asked questions about cat heart disease. So she's going to go ahead and get us started.
Dr. Denny, what do I need to look for as the first sign of a heart issue in my cat?
So that's a tough one because sometimes cats can show no symptoms until things are really progressed and very, very life threateningly serious. But I would say rapid breathing, exercise intolerance, and coughing. But sometimes we don't get symptoms. Unfortunately, we get phone calls sometimes where a cat has just passed away. And I mean, we get no symptoms. Like that's the symptoms. And if we perform an autopsy, sometimes we'll get answers. So with cats, we have very low, like there's not as many warnings as there are in dogs. Certainly if your cat is hiding more lethargic, these are things that you can bring in and we can hopefully catch it early.
Do I need a board certified cardiologist to diagnose heart issues in my cat?
So I think yes and no. So let's talk about like the grades of heart disease and different types of heart disease. So, am I capable of diagnosing heart disease if I'm allowed to do diagnostics? Yes. Okay, we can get chest x rays done here. We can do a cardiac echo here, blood pressure, screening for cardiac enzymes here. So we're very capable of like making a diagnosis, even off a physical exam, if you hear a murmur or an arrhythmia. When I'm going to reach for, boarded cardiologists on the veterinary side is if I've got a case where it's a young cat and, I'm needing help with how quickly progressive a disease is becoming, or maybe a cat's not responding to regular treatments. So, and I need a little bit of help. Then we'll talk about referral. I will always offer referral anytime we make a diagnosis of heart disease and talk about that because that's always an option.
How do I know if my cat has any heart issues?
So hopefully I'll tell you, or your veterinarian, wherever you go, your veterinarian will tell you, right? That's our job. That's the whole reason you're paying us. We're here to make sure that your cat is healthy. So hopefully you'll be told on a physical exam. Otherwise, you're wanting to look for symptoms like hiding, lethargy, decreased appetite, rapid breathing, coughing, collapse. Those are going to be major symptoms.
How are heart murmurs in cats diagnosed?
With this really cool thing that I'm wearing around my neck. So, stethoscope. Okay. So, with this, and I actually have a cardiac stethoscope because I'm a little bougie when it comes to my stethoscopes, to be quite honest. I like the really high power ones, but we can hear a murmur. So, when we're doing part of our physical exam, when I'm listening to the heart and the lungs, is I'm listening for a murmur, I'm listening for changes. With cats, it's hard because they can have silent heart disease. So, if we have a breed that's predisposed to heart disease genetically, like a Sphinx or a Ragdoll or a Maine Coon, then I might even recommend yearly cardiac enzymes being sent out with their annual lab panels.
What does an echocardiogram show that an x ray doesn't?
So there are two different modalities, right? An X-ray is an X-ray. So an X-ray, we're going to get to see the size of the heart. We'll get to see if the aortic arch is elevated. With cats with hypertrophic cardiomyopathy in the advanced stages, you can actually see something what's called a Valentine's Day heart. So like you see on the cards, like it looks like a heart. And that is because the heart wall is getting thickened. We can actually see that on x-rays. A cardiac echo is using an ultrasound. So it's actually using an ultrasound probe on the chest. It's non-invasive. And you're measuring the size of the chamber, the size of the valves. You're measuring the blood flow. We're measuring how thick the walls are, the contractility of the heart. We're looking to see if there's a blood clot hanging around there. So there are two different modalities.
What is the prognosis of my cat if they are diagnosed with a heart issue?
So it depends on which one it is. Okay. If it's a congenital heart defect, it'll be dependent on what kind of defect your cat has. Prognosis can vary from very poor, like the kitty cat might not have very long, to something maybe they can live with for 10 to 12 years. If your cat has hypertrophic cardiomyopathy, also known as HCM, they can live for years. I've got a Sphinx baby right now that is actually like one of my favorite kitty cat patients on the face of the planet. And he's 3 years old and he has early stages of HCM. And so, we see him like multiple times a year. He gets echoes, he sees a specialist. And, he doesn't need meds right now, but he will. But I would not expect him to make it to 15, 16, 17 years of age. I would hope so because I love him so much, as does his owner. But you just don't know. It's really hard to put a time because I don't have a crystal ball, right? I always say that with clients with this kind of stuff. If I had a crystal ball, I would absolutely use it. Because I can't tell you like how long. I can tell you what the averages are, but no one is God. Like we can't tell you exactly like how long do you have.
Which heart conditions are considered treatable in cats and which are not?
So there are some congenital heart diseases where they can go in and perform open heart surgery and actually fix the defects, just like in humans. So those are treatable. There are certain like murmurs in cats that they like mitral valve disease or other valve diseases where we can put them on medications to help the heart function and slow down the progression of disease. HCM or hypertrophic cardiomyopathy, unfortunately, we can try to slow things down, but we can't reverse it and we can't stop it. So, when we say like treatable, they're manageable, right? But you can't cure heart disease. You can only manage the disease and add medications in as it progresses. So I hope this helps answer some questions. This topic's kind of a little bit more scary and a little more sinister. And if you have had this talk with me in an exam room, if this is going over your head, if this is too much, if you do want to sit down and have a one-on-one conversation, please feel free to call our practice. That's why we're here. We're here to help you guys through the hard stuff. It's my job. My job is to not only take care of my patients, but also guide my owners and navigate through these diseases because it can be hard to understand. And my job is also to prepare you and hold your hand if things maybe aren't going as well. So we are here to help. So please give us a call if you need us. Thanks.